confident that in no time we should be able to get the requisite number. I pray for the local government autonomy.
Local government autonomy, biggest challenge to review in 1999 Constitution. Omo Agege confides in President Buhari.
We have seen people carrying meat on their shoulders in keke napep or motorbike, bicycles and all, and it's very, very unhygienic.
Federal government directs use of refrigerated van for meat transportation across the country.
Allow states generate, regulate and distribute electricity. Nigeria Governors Forum clamors at public hearing.
On Good Morning Nigeria today, we shall discuss 2023 expectations for the health sector.
All right, when COVID-19 hit Nigeria, like the rest of the world, the resilience and strength of the health sector was absolutely put to the test, and it was a clear indication of the need for improved investment in the healthcare system.
Yeah, quite right, Claire. And just like the Hydra-headed monster, the pandemic remained adamant, and Nigeria was put on her toes to calm the health challenge that took the world by storm.
And again, in the year 2022, medical practitioners did not have it so good. It seemed tougher, with the hiccups and further overwhelmed the fragile status of the healthcare institution. Now we're talking about emerging and of course re-emerging infectious diseases such as monkeypox, cholera, Lassa fever, yellow fever. All those exacerbated the crisis with huge records of death.
And industrial actions and threats by the medical professionals, were frequent in the outcome year. However, nothing prepared Nigerians for the dearth of skilled medical workforce due to brain drain.
Indeed, according to 2022 UK immigration report, over 13,000 Nigerian healthcare workers, including doctors, of course, were granted working visas in the past year. That's, of course, 2022, leaving Nigeria as the second country with highest brain drain after India.
Yes, indeed, Claire. Brain drain after India. But what happened in India is that there's now brain gain when it comes to medical practices.
Yes, India was able to reverse the status quo,
reverse it and get their system equipped. The people now, India makes a lot of money through medical tourism. All right, now the Nigerian Medical Association, NMA, lamented that 34,000 doctors served about 180 million people in the country in 2015. And sadly, this year, the number dropped to 10,000 doctors for the over 200 million population.
All right, now a watershed of institutional prioritization came in May 2022, and that's when the National Health Insurance Authority, NHIA, was inaugurated. Of course, it became an act as part of government's effort to attain universal health coverage for over 83 million Nigerians. It was signed into law, thus transforming into health insurance mandatory for citizens and legal residents, while also empowering the NHIA to be a more effective regulator and integrator.
All right, and again, for the first time in the history of health funding in Nigeria, over 1 trillion naira was allocated to the sector out of the 21.8 trillion naira for the 2023 fiscal year.
Indeed, very, very encouraging, although still below the benchmark. We'll be talking about the benchmark in a moment, but the amount comprised 404.08 billion naira, and that's for capital expenditure, while the recurrent expenditure was allotted 580.82 billion naira. Of course, that's with an inclusion of some other funding, 2.5 billion naira for aids and grants, provision of 62 billion naira for retained independent revenue. That's for other projects that the health ministry or health agencies might want to execute, and that shows significant increase from the 826.9 billion naira allocated to the health sector in 2022 and 547 billion allocated in 2021.
Yeah, you can say that again, Claire. Because despite the increase, Nigeria is yet to meet the commitment by African leaders under the Abuja Declaration to allocate at least 15% of their annual spending to the sector. So what are the underlying critical measures to improve Nigeria's health sector? What are the expectations for 2023 and the wake of the renewed alert on the deadly Ebola virus disease owing to emerging trends around sub-Saharan Africa? What measures can be deployed to forestall any possible outbreak of Ebola and other infectious diseases, not forgetting COVID-19 and even bird flu? These are some of the questions we intend to seek answers for when we discuss expectations for the health sector in 2023. Good morning and welcome to Good Morning Nigeria. My name is Nigerian. Thank you for joining us.
And I'm Claire Adilabu Abdulrazak. I'm actually smiling because of the mention of COVID-19 and Ebola. I know Nigerian doesn't like to hear those. We talked about it here, one or two editions, and of course we know his reactions. I hope we will get to see more of his reactions. But this is welcoming you once again to Good Morning Nigeria. It's Friday's edition, and it's live on the network service of the NTA, Africa's largest TV network. Again, we have our complimentary segments in the course of the program. The highlights of the morning news will be coming first, and later on we'll take on business news, and much later, Boy will be joining us for a review of the newspapers. And Chupono is in the newsroom. Hello, Anne. Good morning.
Hello, Claire. And Kieran, good morning. Here is the news. Deputy President of the Senate, Ovie Omoagege, has identified the local government autonomy bills as the biggest challenge to the ongoing review of the 1999 Constitution. Senator Omoagege stated this while briefing State House correspondents after an audience with President Muhammadu Buhari at the presidential villa. He dismissed criticisms about the constitutional review process being an exercise in futility. He, however, blamed state houses of assembly for failing to vote on the amendment bills, especially on local government autonomy transmitted to them for concurrence.
What matters to us, which is a priority to us, which is a big priority of Mr. President, is this issue of the local government autonomy. And that's why we're having challenges. But we believe that with time, we'll be able to resolve this.
Ahead of the February 25th and March 11th general elections, INEC has established a National Situation Room and Collation Center where the results of presidential elections will be collated. A statement by INEC's National Commissioner for Information, Festus Okoye, notes that INEC has designated the International Conference Center, ICC, in Abuja to serve as the venue for the collation of the presidential election results. Accordingly, the Commission has established 2 committees for this purpose. The Collation Center will be headed by the chairman of INEC, Professor Mahmoud Yakubu, in exercising his constitutional responsibilities as the Chief Electoral Commissioner of the Federation and returning officer for the presidential election. In addition, a few technical staff will assist him. The Situation Room shall be responsible for the preparation of the venue, sitting arrangements, utilities and services, security, the accreditation of party agents, as well as the national and international observers and the media. Still on INEC, the collation of PVCs takes effect at the ward levels from Friday, 6th of January 2023, and all validly registered voters who are yet to collect their PVCs are encouraged to proceed to their wards to do so. INEC, in a statement by its National Commissioner for Information, Festus Okoye, notes that after the 15th of January 2023, the exercise will revert to the local government offices of the Commission until the 22nd of January 2023. All eligible and valid registrants can collect their PVCs from 9 a.m. to 3 p.m. daily, including Saturdays and Sundays. All those that applied for replacement of lost, damaged or defaced PVCs can collect their PVCs at their wards during the period, and the same applies to those that registered prior to the 2019 general elections and are yet to collect their cards. The PVCs of those that applied for transfer are available for collection in the local governments and registration areas where they intend to vote, and not in the state or local governments where they carried out their transfer. The Nigeria Governors Forum says states should be allowed to generate, regulate and distribute electricity from their states rather than the Federal Ministry of Power. This was at a public hearing on a bill to amend Electricity Power Sector Reform Act 2005.
Provisions of the Constitution that make power, electricity, the concurrent responsibility of the federal government and the states. And the Constitution is quite explicit.
We must at all times pay attention to little details.
And the federal government has banned the conveying of meat unhygienically in open vans, motorcycles and wheelbarrows. Minister of Agriculture and Rural Development, Mohammed Mahmoud Abubakar, says government will confiscate any meat transported in such manner for contravening the directive.
We have seen people carrying meat on their shoulders in keke napep, on motorbike, bicycles and all, and it's very, very unhygienic. And food safety is being threatened.
The livestock sector is a multi-trillion naira business that is left in the hands of untrained practitioners.
Now to some security stories. The federal government has commenced the payment of security debarment allowance to the veterans of the Nigerian Armed Forces. The Permanent Secretary, Ministry of Defense, Ibrahim Abubakar Kana, announced this at a meeting with the veterans in Abuja. 21 billion naira, representing 28% of the total outstanding security debarment allowance approved by President Muhammadu Buhari to the ministry as first tranche, is in fulfillment of the promise made by the government in September 2022. The Ministry of Defense, in collaboration with the Ministry of Finance through the Military Pensions Board, initiated the commencement of payment of the allowances. Meanwhile, tactical operatives of Zamfara State Police Command have rescued 15 travelers kidnapped on the 1st of January 2023 along Zaria Guzo Road. The rescued victims, who hail from Zamfara, Sokoto, Kebbi and Kaduna states, include 7 women, 6 men and 2 children. Public Relations Officer, Zamfara State Police Command, Mohammed Shehu, who made this known in a statement, says the victims were safely rescued following the deployment of additional search and rescue operation team to the location where they were believed to have been held hostage by the terrorists. He says the victims have been medically checked and debriefed, preparatory to reuniting them with their families. Well, that's the news for now. Good Morning Nigeria continues with Claire and Kirian after this break. Stay with us.
Oh, better days are coming. Better days that gives us hope and strength. All Latino boys determined to keep this hope alive. Bring the smiles back to all Nigerians.
It's a new dawn in Nigeria. Renewed hope beckons on our people. The silver lining dots the skies. The firmament portends a bright future as the people of Nigeria move to vote a man whom they have come to trust for the realization of their aspirations for a better Nigeria. That man is Asiwaju Bola Tinubu. He has been tested. He can be trusted. Vote Asiwaju Bola Tinubu as President of Nigeria 2023. Vote Kashim Shettima as Vice President. Vote APC. Surely with Bola Ahmed Tinubu, the smiles are returning. We are close to home.
Bring the smiles back to all Nigerians.
Introducing an all-time mega offer. Get over 50% discount in the Airtel Home Broadband Mega Offer. Buy a router for just 10,000 Naira and get up to 240 gigabyte or a MiFi for 5,000 Naira and get up to 125 gigabyte bonus data. More data, more you. Reliable home broadband by
Airtel, the smartphone network. Nigeria, African beauty.
Our pastors, our imams, in every church, in every mosque, please realize that in the course of praying for peaceful and transparent elections, we all have duties beyond prayers. If we want a stable society before, during, and after the elections, what should you be saying to those that worship with you? All Sundays and all Fridays, you are saddled with the responsibility of bringing up good generations. It is therefore your duty to both man and God to ensure peace all the time, no matter about elections alone. People talk to people and people listen. Talk to your followers. Make them listen to ensure peaceful 2023 elections. This message is from the National Orientation Agency.
I, Senator Aisha Dahiru Ahmed Binani, heartily welcome His Excellency President Muhammadu Buhari, GCFR, Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, to Yola on Monday, 9th January 2023 for the flag-off ceremony of my governorship campaign on the platform of our great party, the All Progressives Congress, APC. Your Excellency, Adamawa is your second home. You are always welcome. Nigerian women are highly elated for such an honor in supporting the campaign to elect a female governor for the first time in the history of Nigeria's democratic governance. Your tenure is playing another first. As you come to Yola, we welcome you with all our soul and heart. Announcer Senator Aisha Dahiru Ahmed Binani, Adamawa State APC governorship candidate.
Nigeria, it's live on the network service. You're right on time for us to catch some business tips, and the Nigerian Export Promotion Council, NEPC, is saying implementation of strategic programs is now yielding results and will ultimately increase performance of the non-oil exports. We have details with Kunle Adeyeye.
The Nigerian Export Promotion Council, NEPC, says the implementation of a 50 billion naira export expansion facility program, EEFP, as part of the economic sustainability plan is beginning to yield results as the country is now recording gains in export volume.
From January to June, with over 200 products that were exported to different countries, different destinations. That's very good for us. Some of the products that we thought would never make it to the international market are now being sold internationally and are being accepted. And so I think it's a great achievement for us. And thanks to the Buhari administration, who has given us the enablement, the resources to do what we are doing as an agency.
The bulls could not maintain control of stocks trading at the exchange on Thursday as a total of 138.7 shares in 3,673 deals corresponding to a market value of 1.828 billion naira were traded. Compared with the previous trading day, Wednesday, January 4, Thursday's data shows 48% decline in volume, 86% decline in turnover, and 12% decline in deals. The current market capitalization of the Nigerian Stock Exchange is 27.7 trillion naira. Sterling Bank recorded the highest volume of 29.9 million traded shares, followed by a Guarantee Trust holding, which is 19.9 million naira, and Access holding 11.3 million naira. With business news, I'm Kunle Adeyeye.
Thanks, Kunle, for that package. We appreciate that. Up ahead on Good Morning Nigeria is newspaper review.
All right, it's time for a review of the newspaper, and as usual, we have Chukwudi Ukuli Ugwaja. For me, it's Chuxtable.
Yeah, yeah.
Good morning, Chukwudi.
Thank you so much.
Yeah.
It's always good to be here.
Yeah, you're welcome. All right, we have 3 papers for review this morning: The Sun, Punch, and The Blueprint. Let me begin with the Punch newspaper. Above the name flag, consumers say electricity tariff hike illegal. Anger spreads. Pages 21 and 22 of the Punch newspaper. Federal government gives operators ultimatum to name oil well owners. It's on page 21. 2 senior lawyers want EFCC scrapped. That's on page 8. Now, the lead story on the Punch: 28 governors pile up 5.8 trillion naira debts for incoming governments. 2 riders: states' debts to rise above 200% of revenue in 2023, as reported by the World Bank. Lagos cannot execute laudable projects without loans, according to the commissioner. All right, now the photo story is that of the burial of Pope Emeritus, who just died. Now, supporters demand sainthood for Benedict as ex-pope is buried. All that on page 8. Now, suspected terrorist killed in shootout with Katsina police is on page 5. How Lagos policeman ministry paid 185,000 for newborn. The story is on pages 16 and 17. Now, Lagos-Ibadan highway commuters groan as Julius Berger returns. The story on pages 4 and 5 of the Punch newspaper. Claire,
Yes,
maybe you have to take the Sun
I
before.
have the Sun, the Daily Sun newspaper, and we'll start with the headline story. FG states local governments go full cashless March 1, and defaulters risk 3-year jail. NFRU warns. 3 tiers withdrew 1.082 trillion naira in cash between 2015 and now. And trending on the right column, G5 governors in Oyo keep mum on Atiku, seek support for other parties' candidates. The details of that on page 26. Now, Custom loses 4 officers, arrests 176 smuggling suspects. Again, details of that on page 24. Local government autonomy stalling constitution review, and that's according to Deputy Senate President Vioma Agege. It's on page 6. NDDC money spent in Abuja, Dubai, others. Onochie, board chair, declares. It's on page 29. Again, NDDC money spent in Abuja, Dubai, others. According to Onochie, that's the board chair, NDDC board chair, on page 29. EFCC shouldn't be in existence, doing same job as police. Agbakoba, that's on page 4. Now, only countries investing in technology can succeed, says Naseni EVC. It's on page 27. And again, the story trending at the foot of the paper: NNPC denies exporting 17.87 million barrels of oil without documentation. NNPC denies exporting 17.87 million barrels of oil without documentation. You can find the details of this story on page 2. And the picture story today is the marching orders given to security agencies by the president. You see the picture story there. It says, end crude oil theft by May 29. End crude oil theft by May 29. And you see the Nigerian midstream and downstream petroleum regulatory authority members: Farouk Ahmed, Minister of State, Petroleum Resources; Timi Perseva, Chief of Defense Staff, CDS, General Lucky Rabo, GCEO, NNPC Limited, Mele Kyari, and Chief of Naval Staff, Vice Admiral Awal Gambu, visiting troops of Operation Delta, safe fighting crude oil theft in Warri, Delta State. And that event took place yesterday. So that's the outlook from the Daily Sun.
Okay,
Q,
yeah,
you have another
let me
one.
quickly run through Blueprint before Chukudi comes in. Blueprint newspaper, let's get that on the screen. Now, Tinubu fires OBJ, says you are unfit to recommend president for Nigeria. Three riders to that. I created local government areas. Wicked Obasanjo seized our money, punished us. All right, now the other one, you don't follow a man who doesn't know the way. Asiwaju resisted Obasanjo's plan for one party state, according to Shomala. Well, all that is politics, and if you want to get more on that, you go to page 6 of Blueprint newspaper. Now, the lead story from 2015 to 2022, NFIU says the federal government withdrew 225.72 billion naira, states 1.54 billion naira, local government 156.76 billion naira cash, with two riders. Issues new guidelines stopping withdrawals from public funds, payment of obstacles, overseas allowances too from March 1. All right, that's the list story. It's on page 23. Now, federal government projects 3.75 GDP, 17.16%. Inflation rate in 2023 budget. That's on page 5. Let's revive technical colleges for technological breakthrough, according to Nasani, Professor Haruna there. On page 9, no recruitment aptitude test, January 8th, NSCDC wants applicants. The photo story is on electorate searching for their permanent voter cards. I hope that is not becoming chaotic. All right, that's the photo story on Blueprint. And below that, Damn Modi 2023, how APC plans to take Jigawa youth off drug and thuggery. Okay, so on page 7. Now, at the bottom of the Blueprint, INEC names ICC Abuja Collection Center, moved PVC collection to wards. Reports of 17.877 MB crude export malicious. That's NNPC Limited. All right, now, local government autonomy bill, biggest challenge to constitution amendment. Omo Agege is on page 18. We will disclose G5 governors presidential candidate soon, according to Otom, the governor of Benue State. FCTA resumes, impounds and crushes operation, flattens 200 motorcycles in Abuja. Now let's bring in Chukudi now.
I was just saying that Chukudi, we could just to review the headlines, stories across. I think we have similar headlines. The headline, you have federal government withdrew. I also have it. So let's quickly look at that first.
There once I had an in-depth look at.
Yes.
Okay.
Yes.
Just go ahead.
So because it's saying that it's the NFIU, of course, saying that the three tiers of government, are withdrawing huge amounts of money in cash through banks, and it totals, the amount to 1.08 trillion between 2015 and now, and it's giving out the warning that from March 1st, it expects that federal, state, and local governments should go digital. All monies to be withdrawn must not be in cash. It must be made through the, processes.
It was actually needless saying that I hope is the one I had an in-depth look at, because it seems journalists think alike all the time. NFIU, that's the Nigerian Financial Intelligence Unit, stops cash withdrawals from government accounts. Are we saying that some ministries, that's actually the question I'm asking, departments and agencies are still or were still taking cash from government accounts? That's unthinkable. That's unfathomable. Now, the implications are, if they are doing that, it defeats the cashless policy, but that's on the nominal, rule, so to speak. The real point that should be dreaded is that it makes it difficult to trace fraud, and it helps people help themselves to monies that they are not entitled to. I'm not going to waste too much time on that. Besides what you're going to bounce up from your side. What the NFIU needs to do is to wave the stick. Look at what happened when petrol, PMS, because it did not affect AGO or DPK, kerosene and diesel. It was PMS that suddenly, about 3 weeks ago, 1 month ago, we were still finding difficult to buy. Maybe that's talking too far back. Just 2.5 weeks ago. Till the DSS said, look, we give you 48 hours to make fuel available. Kirian, Claire, are we not seeing fuel now? It matters that things get enforced. So the NFIU should go out of his way, if necessary, to bring culprits to book. We must be able to trace expenditure.
What is the monitoring mechanism that's been put in place to checkmate that? That's the point. You just make law, or perhaps make statement to say, look, federal government withdrew, issuing guidelines, stopping withdrawals from. How do you check it? Because there are so many facets of administration in agencies, ministries. So ministries, have about 10 to 15 agencies under them. How are you going to monitor them? Because invariably, these agencies require money for the day-to-day operations of the agencies. And in some cases, you have to pay cash one way or another. So, listen, see, if you have worked with people who run such agencies, perhaps through the accounting system, auditing system, you appreciate what I'm trying to tell you. Because one, if money is needed today now for an emergency, for instance, in an agency, and the person whom you are going to pay the money does not have, perhaps it's not captured in the system that could pay him from government pos. They have systems, for payment. Then he cannot pay the person because it's not captured. So how do you pay and get that thing done?
Let me also come in here.
It's somehow complex.
Let me also come in here because it's a good thing. It's desirable that we all go digital. It makes transactions quite seamless and less cumbersome. But we must also look at the challenges, because we don't just come when we come up with a law, we bang it, bang, full force. I think it's a gradual thing. There must be limits. I think the NFIU should consider setting benchmarks, that government institutions can withdraw in cash. Because, Kirian, this matter we're talking about is controlled by ICT. It's controlled by internet. Check your internet transactions. It's quite difficult. Many of us can't even, complete our transactions, our money withdrawals, via our apps as quickly as we can. So we must consider the issue of internet penetration, internet infrastructure.
So sometimes we send money. The money is hanging. The money is hanging.
I dare say.
Meanwhile, you have.
So these are issues.
I dare say that I'm surprised you're saying this. If I get to the level where I do business with government, the ministry, department, or agency must have spelled out in their documentation the processes I have to undergo before I can do business with them. Are we thinking of monies they are withdrawing for their own domestic use? Is that what we're thinking about?
No,
I think it's more of monies that ministries pay out to people who do business with them. The law enforcement agencies must have a footprint of the monies going out. Otherwise, fighting sleaze is completely impossible.
Okay, let's look for other issues. Let's look at other issues that we can touch so that we don't dwell on this for too long. Yes, because
so we don't encourage laziness.
Yes, if you're not captured, if you're not captured in the remiter,
you must be captured.
Excuse me,
before you can do business.
If that's what I'm saying, but for agencies to now capture all the people that do business with on remiter, that's what they should do first, so I can pay them, to run their day-to-day programs. So let's take another stories.
Yes, we have one on ASU asking that the education tax be shot up to 10%. The argument is that they need more money, more resources to run tertiary institutions properly. Now, the occasion was the launch of 50 books sponsored by TED Fund. That's the Tertiary Education Trust Fund. The launch of the books, that was where the president of ASU, Emmanuel Osedeke, spoke up, saying that if the education tax fund is taken to 10%, it would help them have more resources. Now, the question is this. Chono, that's the TED Fund executive secretary, actually said that we should remember that this government took the education tax fund from 2% to 2.5%, and that there are actually prospects of taking it to 3%. So government is not mindful of the need for this to go up. But going up to 10% might be seen as drastic by companies who are struggling to make profits and all that.
Yes, but the question is, the money that is available for ASU, how is it being expended? That's the point, this raising of money. And now you brought in education. Let's talk about this, the issue of let's revive technical colleges for technological breakthrough in the country. I don't know where you went to school, high school, right? My high school, Colliery Comprehensive School in Wo,
Yeah.
we had the comprehensive element of a secondary school in that school.
Yeah.
There was woodwork, which is today's carpentry. We have metal work, we have welding and all of that in the school, high school.
Call it trade school.
Exactly. Now, those that are not prepared to read voluminous, history, biology, and what have you, they're branched out to technical area. So now that in Nigeria today, if you want to do a construction, a house, you find Nigerians, you find Beninoans who are here, who are either tilers or that they do POP and all that. So you see, Nigeria is losing that artisanal technical section of the society that is very important.
I like
plumbers,
that artisanal,
yes,
inclination.
yes.
Now the thing is this. Who was it? I think it was during the time of Okoje
at the government training colleges.
Yes, at the National Universities Commission. He was saying that a university education does not quite prepare you for a job. That it is just for you to raise awareness of the critical mass,
exactly,
so that you can start thinking for yourself and all that. But I go with you when you say that these things have to be activated into the region of people being able to do something with what they say they've learned in school. That's why I like the bundling of the mass communications departments in the various tertiary institutions. Now people can go into film production. People can go straight into
broadcasting.
Broadcasting. I think it's about 8 or 7, units that came up. What it means is that nobody is going to tell you anymore that he stepped out of the university and he can't handle a camera.
All right, Chukwudi, I think we have to stop it at that.
You understand?
I've allowed both of you, some time to catch your breath.
Thanks for allowing us. Yesterday was different.
All right, so thank you, Chukwudi. We would have talked about the issue about local government autonomy, but we'll leave that, for another day.
Okay.
We'd like to thank you once again, Chukwudi. Do have a pleasant weekend, and we'll see you here in your full...
Yes. Always bouncing.
Your full Chooks the
By
boy,
his grace.
Chooks the boy elements.
No, you don't want to see that.
Go
No. You don't want to see that. Chukwudi, please. All right, let's take a break now. We'll be right back.
They swore an oath to serve our fatherland and defend the people. They traded their freedom, comfortable homes, and mortgaged their lives on the battleground for our unity and peaceful living. These are the great, fearless, loyal, and committed Nigerian armed forces who risked their lives courageously to safeguard our borders. But in the line of duty, many never returned. Nigerians, arise, let's celebrate our fallen heroes. Put on the remembrance emblem with pride to support the incapacitated and families of our fallen heroes.
The occasion gives cause for reflection and reminds us of the sacrifice made by our armed forces in preserving the unity of the country.
All ministries, parastatals, religious and corporate bodies to donate generously to the Emblem Appeal Launch. Send your donations to these accounts. Account name, Emblem Appeal Launch. Account number 393-200-7526. EcoBank Nigeria PLC.
Operation Wild Punch covers Kaduna and Niger states. The operation was recently reorganized to also cover the critical Abuja-Kaduna Expressway, which had a defunct standby alone operation codenamed Operation Thunder Strike. Additionally, as part of the Operation Wild Punch, a subsidiary operation
codename Operation Forest Sanity has also been launched to flush out the terrorists from the forest that straddle Kaduna and Niger states. These efforts were geared towards flushing out criminal elements from the Kaduna-Abuja Expressway and its environment. I am pleased to inform that Kaduna-Kaduna Expressway has been secured through a combined efforts of the armed forces, the police, and other security agencies.
This message is brought to you from the Federal Ministry of Information and Culture.
To every politician, as the campaigns gain momentum and passions begin to rise, remember, the errors of your opponents do not make you a success. Do not run down your opponent and inflame passions to violence between and among your supporters. What counts is what you plan to do for the electorate and how you intend to relieve the sufferings and bring succor. Nigeria is in dire need of patriotic leaders at all levels, leaders who will make national development their priority. Concentrate on telling the electorate what you intend to do when you get into office. Focus on making your vision clear to the electorate. Don't engage in verbal abuses, fake news or speeches. Keep dealing with issues that will bring progress. You win the hearts and minds of the people by being above board, by being civil, patriotic, and showing empathy. Let's join hands to make the 2023 elections peaceful. A message from the National Orientation Agency.
Our country people, they talk with one voice. Them say na Asiwaju Bola Tinubu them want as president of Nigeria for this president election.
Asiwaju Bola Tinubu na the man where we all know and see all the good work in they do for we country, especially when him be governor of Lagos State.
Now him God use turn Lagos to the best state for Nigeria.
Today, many people all over Nigeria they like to go Lagos, go settle down for business and better life.
All because of the good work when Bola Tinubu do.
People of Nigeria, as Asiwaju do for Lagos, now so him ready to do am for the whole country.
Vote Asiwaju Bola Tinubu for president of Nigeria. Vote Kashim Shettima as vice president. Vote APC, the party we get a broom.
We want
All right, we thank you for staying with us on Good Morning Nigeria this Friday. And to begin our discussion on the expectations for the health sector in Nigeria, let's get this background report as put together by Ekene Ndulwe as a prompt for the conversation.
The start of a new year comes with fresh expectations, hopes and dreams. It is the dawn of 2023, and Nigerians with the benefits of hindsight are expecting improvements and interventions in the health sector. 2022 came with its challenges, with shortage of healthcare providers posing major public health concerns. A 2022 report from the National Primary Healthcare Development Agency indicates that Nigeria has a ratio of 4 doctors to 10,000 persons, a huge shortfall of the WHO recommended ratio of 1 doctor to 600 persons. This is compounded by the Japa syndrome, where Nigerian doctors live in their droves in search of better working conditions outside the shores of the country. At the core of the brain drain issue and constant threats of strike actions is the salaries and welfare packages of the health workers, which they often complain as being poor. The huge out-of-pocket spending for health services in Nigeria is also a source of concern, with records showing that 8 out of every 10 Nigerians are without health insurance cover. In May 2022, President Buhari took a major step to provide increased coverage for about 83 million Nigerians when he signed into law the National Health Insurance Authority Bill 2022, which repeals the National Health Insurance Scheme Act that has been in existence since 2004, tackling some of the perceived challenges in the health sector, apparently requires adequate funding. And the 2023 budget, recently signed by President Buhari, has seen an increment in health budgets from previous years. 2023 saw a budget of 1.17 trillion naira allocated to the health sector, out of the total 21.8 trillion naira for the 2023 fiscal year, an improvement from the 826.9 billion naira allocated to the sector in 2022 and 547 billion naira allocated in 2021. Health experts are, however, still worried that this figure represents only 5.35% of the budget, a shortfall from the 15% of the annual budget recommended by the African Union at the Abuja Declaration in 2001. On this edition of Good Morning Nigeria, guests shall be discussing expectations in the health sector in 2023.
All right, thank you very much, Ikene, for the points that you brought out in that report. Of course, increased budget allocation to the health sector. There were also other efforts to reposition the health sector, of course, by repositioning the National Health Insurance Authority. There's also the percentage increase in terms of budget allocation, but still falling below African Union's benchmark of 15%. We have quite a lot of issues to talk about on today's edition of Good Morning Nigeria as we again look at prospects for 2023 in the healthcare sector. We have distinguished health managers in Nigeria seated here in the studio, and of course someone joining us from Enugu via Zoom. Let me begin the introductions. We have the pleasure of seeing for the first time this year and welcoming him with all arms to our studio, the Honorable Minister of Health, Dr. Osage Ehanire. Good to have you with us and Happy New Year to you.
Thank you. Good morning and Happy New Year to you.
We are also happy to welcome to our studio live for after a very long time, though he does join us via Zoom sometimes. Professor Abdusalami Nasidi is no stranger to Good Morning Nigeria. He's a pioneer DG, Nigeria Center for Disease Control, NCDC. Thank you, Prof, for joining us.
Thank
and
you very
compliments
much.
of the season.
Compliments of the season. Happy New Year to all of you, and Happy New Year to Nigerians.
Yes, it's also good to see you once again.
Yes, thank you very much.
All right. With us here as well is Dr. Isaac Akuma Abuja, a public health specialist. We're glad to have you here, sir.
Thank you very much. Good morning and Happy New Year.
Yeah, and via Zoom, as my colleague earlier indicated, we have Dr. Uche Ojima. He's the president of the Nigerian Medical Association, NMA. He's joining us from Enugu. Yeah, good morning and welcome. How is Co City this morning?
Good morning, Kirian. You know, Co City is your city.
Yeah,
we are very calm. I may greet the Honorable Minister, Professor Nasidi, and Dr. Agboja. It's good to be here. Happy New Year.
All right, Dr. Uche, I like your surname Ojima, which means you're always in possession of good things. So I do hope that we'll be able to elicit good ideas from you today on how we can move the healthcare forward. Let's come back to the studio once again, gentlemen. We welcome you all, Honorable Minister of Health. As always, we'll start with you to give us a general overview of 2022 in terms of the health sector. In evaluating performance, I would like you to also tell us how the JACBA syndrome, I'm sure you understand what JACBA means, affected the healthcare in Nigeria.
Thank you for the invitation and for the opportunity. The health sector, as you know, is a work in progress, and we have taken the opportunity of rebuilding the health sector to introduce new programs The Basic Healthcare Provision Fund has already been established and is expanding. We are disbursing. We are focusing also on the balancing the health sector because, as you know, the health sector offers primary, secondary, and tertiary care, and a new level of care which they didn't exist in an organized form before, which is the emergency medical service that we see to the needs of patients where they have problems and when they have problems. Now, expenditure in the health sector, as you said quite rightly, has been a heavy load of out-of-pocket expenditure for the ordinary person, more so during emergency. So in emergency care, there will be no expenditure at point of care by the patient. That is a guarantee to save lives. Now, the expenditure generally has heavily been in favor of the higher levels of care, tertiary. We don't want to talk about reducing that, but in balancing expenditure, we need to put attention where it is due, and that is at the lower level. There's a good number of Nigerians, perhaps half of our population, that has no access to healthcare at all, and that is not in terms with the universal health coverage we are pursuing. We want to have genuine universal health coverage. We want to have inclusive healthcare that is able to offer at least a basic minimum package of healthcare to as many citizens as possible. Our target is 95–100%. So the development of the primary level of care, the improvement of the secondary level of care, and then a connecting mechanism of emergency and transportation care will bring all these levels of care together to have a more functional and more efficient healthcare system.
What are we doing at the moment in terms of UHC?
Well, that's exactly what I'm saying.
What percentage? Because you said the target is to meet, 90–100%. I know at the time we're doing 70 and over 70%
of coverage.
Yes, of course.
Well, what we have right now, in first place, we have about 7,000 primary healthcare centers already accredited, but not fewer than half of them are actually up to the standard that we have been a new standard that we have set, which is a primary healthcare center that works day and night and is available for the citizens at any time at all. So with about 7,000 already on the list receiving the Basic Healthcare Provision Fund, there's a good amount of funding that will give some relief to the poor and indigent, particularly in rural areas where they have absolutely no service. So the coverage is something that is still growing, and it is going to be enhanced with the National Health Insurance Act, which will bring more money and also from contributions of citizens to increase the fiscal space for health.
Okay, Honorable Minister, we appreciate your explanations, but I want to take you a little bit back to 2022. Even beyond that, because in Nigeria, we've known that when it comes to the health sector, it's one of the sectors in the past anyway, that may have been neglected by successive administrations in terms of making provisions for this sector and ensuring that our policies relating to the health sector are implemented to the letter. Because what I've explained to us now are things that you put in place, over 7,000 healthcare centers and all that. But then when you go to all those centers, we may have issues with respect to facilities, with respect to availability of personnel, and what have you. That's another matter. But I want you to go to the area of what I want to believe should have been, Nigeria should have leveraged upon, and that is the outcomes of a COVID-19 pandemic, which triggered what you may like to describe as massive healthcare infrastructure development and provision of facilities and what have you. But again, are you saying that we have really leveraged on that to improve the health sector? Look at what happened in 2022 and all the primary, secondary, and tertiary, and of course the emergency one you have just added. Would you say that that worked out, and were you satisfied, with the implementation of all that in 2022? Because after that, we now look into the prospects of 2023.
Yes, I'm very pleased of the investment that came into the health sector. A lot of money came in, not only the resources from the federal government, but also some state governments also increased funding in the health sector. But from international partners like the Global Fund, for example, received quite a good amount of investment. And the government enabled us to now have an ICU in every one of our states, and also a treatment center and a molecular laboratory center. So those are huge investments. Beyond that, we have over 100 oxygen generation plants now. Before that, we had just about probably 20, 30. Now we have more than 3 times the number of oxygen generating plants, with at least one in every senatorial zone. Some of them will be in federal institutions, others will be in state-owned institutions. But that will increase oxygen sufficiency around the country, which we have never had before. So we're in the process right now of verifying with the new threats we are hearing the status of the oxygen plants, that they are functional and that they have all been installed and that they are producing. We have also received a large number, thousands of oxygen cylinders, because we're also short of cylinders to move oxygen from one place to the other. So the oxygen cylinders have started arriving, and we are distributing them to various recipients in the states. We're also going to make it available to private sector. We shall make oxygen also available to primary healthcare centers. But we need a lot more investment in the primary healthcare center. You said quite correctly that some of them are nothing to write home about at the moment. But the inflow of cash needs to now be visible, and we also work with the state governments to improve the human resources, the workers there, which is a problem in that many places don't have sufficient workers, or they have no workers at all. So we are trying to encourage states to put attention to primary level of care. Nurses, midwives, community health extension workers who are trained for the purpose of serving at that level, and then with the support of doctors, even if it's a remote support by telemedicine or by Zoom or by WhatsApp, for a doctor to support a cluster of primary healthcare centers with advice.
Now, talk about the jab, but sorry, we want you to lay the background for this conversation, as the Minister of Health, after which, other guests, will begin to key in. This jab thing, which of course has to do with brain drain. What about that? Because considering what we learned this morning, the ratio, the doctor and doctors who provide services and for the population, we were talking about 1 doctor to 600, which is the benchmark, the UN benchmark. But what we have is just a little, very much lower than that.
Four
yes,
doctors to 10,000 persons.
That's correct. Yes, that is still something we are hoping to correct. But there are many things here that we must make very clear. One is that the health workforce mobility and migration is a global phenomenon. We don't need to hold ourselves as being failing somewhere. It's happening everywhere. Even the UK has complained that they are losing doctors to New Zealand and Canada. There's high mobility, and many of the advanced countries who can pay better are attracting doctors from many countries. Ghana complained the other day they are losing doctors. Even when we went for a conference in the US, the Minister of Health for Gambia complained that their doctors are leaving. So it's a global phenomenon. That's one thing. Now in Nigeria again, we are actually producing about 3,000 doctors every year. Only about 1,000 are leaving. So we're not really short in absolute numbers, but the employment of new doctors is a problem, and also finishing the training of new doctors after they've graduated is not yet optimal. But above all, the doctors who have been trained, the ones who are leaving are the ones who are highly trained. That's why it hurts us most. Those who have got the most experience and the most skills are the ones who are being taken away to a large extent, and those are the ones we would like to keep. But final point is that actually many of these doctors have also been trained at taxpayers' expense, really. We really expect them to also give a little bit back before they leave the country.
Honourable Minister, we'll get to the details of the recruitment, much later in our conversation. But I also want to, I know you don't like to talk about challenges. I noticed that most times you try not to, look at the challenges. You want to take us, to how we address. But I want us to look at maternal mortality and child morbidity. At a time we were making progress, in bringing down the indicators. I don't know if the statistics I have is correct. Recently, we're told that Nigeria is still topping global maternity ranking, at 34% maternal deaths, and we're having more than 512 maternal deaths per 100,000 births, if that is correct. So I'm wondering, what the minister views, as pushing these high indicators. What are the core reasons that are pushing these indicators high?
Okay, very clear. I like to look at challenges. Sorry if I contradict you, because that's where we can carry out improvements. But you see, the point, these figures you have mentioned are very embarrassing for a country.
But they are correct.
They are, well, they are, yes, they are there. And it's exactly a manifestation of what we said earlier. The fact that the healthcare system is tilted heavily in favor of tertiary and very little in favor of primary. In that, where all these maternal and infant deaths taking place? In rural areas, mostly. Not necessarily in the cities. So in rural areas, it's also taking place among those who cannot pay when they get to the hospital, or those who even refuse to go because they have no money, or because there is even no care center around them at all. So that is why the emphasis of this administration, of President Buhari's administration, is shifting to increasing access at primary level. Because if a woman who is pregnant can do antenatal, receive treatment against malaria, against HIV during pregnancy, and also receive the proper antenatal care, then the chances of losing children with maternal mortality and infant mortality are much reduced. So emphasis on primary health care is one of the answers. The second is the lack of access to care when you need it. If, for example, a lady is going to deliver and the hospital is far away, they can't get there. There's no emergency service. If it's in the night, they will try odd things that we have heard, like taking the lady on a wheelbarrow or on a bicycle. All those are impossible things today. And they are the ones who are providing all these high mortality rates.
Okay.
So if we're able to provide transportation free of charge, because they may have no money, so you are not going to say, pay before I take you. So this emergency service we are bringing in is to address that problem of lack of physical access and lack of financial access at the grassroots level. But we need to improve the grassroots level. We need to improve the primary health care. We need to have midwives. We need to have human resources. We need to have nurses. We need to have oxygen. We need to have all these basic things that require for basic care.
All right, Honorable Minister, thank you very much indeed. Gentlemen, he has laid the foundation, and of course, you listen to him. It's not time for the Honorable Minister to also listen to others to appreciate their perspectives to this conversation. But let's begin with the man who reached us via Zoom. Now we still have the connection right, so let's leverage on that. Dr. Uche Ojima, President of the Nigerian Medical Association. You have to tell us a whole lot, because we hear about threats of strike actions due to salaries and welfare packages to the health workers. We talk about JABA, which is, of course, the brain drain in the medical sector, especially the doctors and even nurses. Right. I also know that it's not all uhuru elsewhere in other climes. In Britain, just last week, nurses were on strike, in the UK and all that. So let's have your own perspective as to what transpired in the health sector last year, and of course the issue of brain drain, which some countries are converting to brain gain. What's your take?
Thank you very much, Kirian. It's my pleasure to be here this year. Let me start by, first of all, telling Nigerians that apart from those that are leaving, Nigerians are also killing some doctors. Let me pay due respect, first of all, to our colleague, Dr. Uyi Ilobe, who lost his life under questionable circumstances last week, and tell the Inspector General of Police to please make haste while there is light. Let us find the culprits and bring them to book. We don't care whether they are cultists or whether they are patient relatives. What we want is justice. And NMA will not back down until there is justice and is seen to have been done. We also pay respect to Dr. Isaiah Ega, who lost his life to viral hemorrhage, what is suspected to be a viral hemorrhagic fever. Was a young man at 33. But he's gone so fast in the line of duty. And we pray for all the doctors that manage him and other health workers who probably has been exposed. May they pass through this ordeal and come out unscathed. Now, let me say this. One thing I found out in Nigeria is that there is no plan. We only continue to make up a plan as we proceed. I would like Honorable Minister to tell us the plan for the health sector for the next 5 years, so that even when they leave office, there is something to continue on. Yeah, there are some improvements in the service, in the provision of essential service equipment, and maybe some trainings. But you see, Mr. Kirian and the other presenters and panelists, what I saw throughout last year was a response to COVID from 2020 till today. What we have been doing in providing oxygen, intensive care, molecular laboratory, these are all targeted at responding to COVID. They are not targeted at improving maternal mortality, improving infant mortality rate, and so on and so forth. They are not targeted at producing more healthcare workers. They are not targeted at retaining the healthcare workers that are produced. So we continue having this response to issues and not a plan that is being steadily implemented that will take us to a certain KPIs. What are the key performance indicators in all these things that have been done? Yeah, there are molecular laboratories in institutions. No one can argue that. There have been MRI purchased recently, a CT scan, linear accelerators, which of course we don't have enough. But all I see is still a response to COVID. But what we are calling for is a holistic plan that is sustainable, that will take our healthcare services to a certain set of indicators. Are we planning to reduce maternal mortality by 50% in the next 5 years? What are the plans? Are we planning to increase healthcare workers by 50% in the next few years? What are the plans? So it is not okay for me, I must tell you. I heard the Honorable Minister once again say that we produce about 3,000 and about 1,000 leaves. Dear Honorable Minister, one mistake we make in quoting that figure is that we think that all doctors that leave go to practice medicine abroad. Some are no longer interested. They go to other fields, and therefore they do not have records with MDCN because they have gotten tired and they moved on. Some have gone to ICT, some have moved to banking, some have joined politics in Nigeria fully, and so they no longer register. So you may have number, but if you're only looking at those that have moved abroad to practice, there is an error there, because some have left to do other things. And so you won't see them on the record of GMC. You won't see them on the record of Medical and Dental Council of Nigeria, but they are no longer providing service. What we are saying is that as at last year, based on data from the Medical and Dental Consultants Association of Nigeria, we have lost about 500 consultants in 2 years. Based on data from National Association of Resident Doctors, we have lost over 2,000 resident doctors in 2 years. When you use a fresh doctor to compare a consultant, it's an anomaly. We are saying that that thing that made a consultant to leave is bad because it affects training of medical students, it affects training, postgraduate training, and examination. When you look around, you don't need anybody to tell you that things are not okay. We talk of primary health care delivery. I challenge NTA. The NTA is a network center with services across Nigeria. Please simply go to the primary healthcare centers in different parts of Nigeria and make a documentary. Let us see what they look like. The primary healthcare centers have collapsed, a lot of them. You have a few in the urban areas where they are really not so important, that have been painted and upgraded and they have solar power. Go to your village. Show me your primary healthcare center in your village. Mine is in a village hall that people donated for services. That is what I have in my own village. And it is now that people are trying to build a primary healthcare center. That wasn't what it was supposed to be. And we keep talking about only medical services. What of dental services? What of ophthalmological services? Nigerians are going blind. Nigerians are losing their teeth and they are dying from infections that arise from the teeth. So there is a lot of problem. But in order not to discourage the government, I want to say that we still note the input towards upgrading our intensive care units. We notice the purchase of some linear accelerators and other things that have been procured. But the salary of healthcare workers, which is a primordial issue in Jakpa, is still not addressed. Let me tell you the story I'm still battling till now. We were supposed to have received the last tranche of the hazard allowance that was increased in 2021, the arrears, by last Friday. But till now, I'm still battling with it because there has been no release for it to even be paid. And this was something that was supposed to have been cleared by December. And not to talk about increment in what they call our salary. If they offer you 2.8 million and 3 million per month, will you stay in Nigeria and take 600,000? It does not make economic sense. So people are still living. Now, what I want our minister to tell us is the plan to increase carrying capacity for medical schools, the plans to produce or establish more medical universities or university of health sciences that has large carrying capacity, the plan to improve the welfare of workers, the plan to make hospitals, a hospital environment conducive with equipment so that people can go to work and they feel comfortable in the environment where they work and it's not overgrown with weeds. And also the plan for security. We need security. They walk in and they kill people. They rape people on duty. We are not aware of this. That doctors on duty sometimes are raped. Doctors on duty are molested. And people lose their relations.
All right, Dr. Uche Ojima, thank you. You've made your points. Of course, you've ruled out a number of issues that you would like the Honorable Minister to address. I hope the Honorable Minister has also taken note of those areas. Let's come back again to bring in our guest, Professor Abdulsalami Nasidi, of course, who was the DG of Nigeria Center for Disease Control. Nigeria Center for Disease Control, NCDC. Professor Nasidi, you've listened to the Honorable Minister and Dr. Ojima, especially the very gloomy picture that Dr. Ojima, has painted of the healthcare sector. I remember when we were implementing the MDGs, concentration was basically at the primary healthcare level. And I remember I was also part of the reporters that went to the remote areas where, primary healthcare centers were, actually rendering, deliveries. We had primary healthcare centers where pregnant women, triplets were delivered, by midwives, midwives, yes. And then you had health centers with medical personnel, doctors attending to these women. What do you make of where we have come? Have we really learned, from the outcome of COVID, of Ebola? And have we, really targeted our investments to the right, tiers in the healthcare sector?
Well, thank you very much. You've helped me to actually organize the way I should respond, because these are the points I jotted down. That the Honourable Minister has enumerated some achievements which are true. We've made a lot of progress and all this, but we had some problems, and that is the problem of not keying in what we call shock absorbers. You have Mercedes-Benz, beautiful Cadiz, and you don't have a shock absorber. So when you are going, you can imagine the gallops you will fall into, and that's what actually happened to our health sector. Then secondly, it's also the issue of lessons learned. The enemy president is talking about, we're over-concentrating on issues that will not improve what is happening on the but what is very crucial and we should not ignore are the social or socioeconomic determinants of health. So it's not necessarily that the progress in health sector is, based on all health alone. There are so many, determinants that if you don't handle, you really have a big problem. So what are the lessons learned? We have always been reactive. This is the unfortunate aspect of some of our healthcare service, that for a long time, before Ebola, before COVID, we've been basing most of our health development plans and all this on more of reactive tertiary service and so on and so forth. Meanwhile, more than 65% of our problems are preventable. They are preventable diseases. They are diseases we could handle. And let's assume, the African Union meeting, that set the 15%, allocation, in the budget to health sector, which was actually, decided by all presidents and heads of states of Africa in Abuja here, referred to Abuja Declaration, address those issues that we should never forget that, one of the best ways to pay back to the masses is to guarantee their health, to give them good health, good environment, good, potable water, etc., and so on and so forth. And, in short, what should be our main, goal and strategy should be, how do we keep Nigerians healthy? We have to be a little more proactive than reactive. But so far, it seems as if that reactiveness is still continuing. And, the next third point I wanted to raise is the issue of quality of service. I think the NMA president mentioned that we are losing doctors. The doctors we are losing, that will hurt the quality of service we are going to provide in the country, and especially the consultants, the experts, and so on and so forth. They are trooping out of the country. If you go to some of the teaching, not primary healthcare centers for now, you go for tertiary hospitals, teaching hospitals. If you had, let's say, maternal obstetrics and gynecology department, you had 15 experts before, maybe 2-3 years ago, before COVID. You go now, you seldom get 3 or 5. I just came back from a rural area, and I saw a primary healthcare center. No doctor, no nurse. I saw, virtually a general hospital that is serving a whole local government with, even adjoining local governments, a population of about 800,000, we estimated. And you have less than 3 doctors serving. So you can imagine even the doctor to, population ratio, which so far is about 4 to 10,000, as mentioned. If you really dig in, it might be worse. So how do we become proactive in building this, addressing this issue? The reality is that nobody will solve it for us. It has to be a local problem, local solutions. And some of the best things to do, as the Honorable Minister mentioned, it's not possible for the federal government to do everything. State governments have to come in. For instance, I give practical examples in what I say. Bayelsa State, they had a very low number of doctors, even though the population is not high and all this thing. The then Governor Dixon, just saw to it that, hey, let the state do something. Let's build our own medical school. They built it. Now they have a medical university, really huge. Just recently, the governor of Kano State, Ganduje, had established a second, medical, college, saying that, Kano, having the largest population in the country, even though we have 4 to 10,000 population ratio in the country, Kano's own is about 4 to 80,000, if you are to take it by the population. And except you really, do the training, you start it now, as he's saying, the NMA, this in the 5-year plan, we are going to end up with a negative ratio, which will really be very devastating. So these are the few points that I believe we shouldn't forget, that the shock absorber, where new diseases like COVID, a new virus that nobody knew about came and shocked us. Then imagine and reimagine diseases are also occurring. We shouldn't forget that we are still having Lassa, we are still having meningitis and others still coming in. But maybe next time I have opportunity to talk about this.
Of course, you have an opportunity to come in again.
Yes.
Thank you for what you have elucidated. As a matter of fact, I don't know. What is even the role of NGOs in the health sector and all that? But we have an association here from a local area, in Abuja here, and we were able to build a health center in a central area in our locality, in the village, and we handed it over to a Catholic NGO. that's running it now. So if you go there, you have Reverend sisters who are also medical doctors. That's the way we have tried to help our own community. So I also believe that such could be done by others to assist. But they have made very clear points that there's no plan, even according to the NMA DJ. But again, I know that in this country we don't like plans or blueprints. I'm sure that if you dig in, you will find blueprint on healthcare development in Nigeria. I'm sure that such document exists. But again, when it comes to implementation, well, we don't know. So let's bring in Dr. Isaac Abuja here. You've listened to others, so you're at liberty to key in from any point of view.
Okay. I think one of the things, let's start from the center, at the national level. One of the things that is lacking is coordination. We were lucky that in 2020, when we had COVID, somehow we experienced it more in Lagos, where we were very advanced in health too. And we were able to handle it better than we should have. I mean, we came out better than we should have. If this COVID has started in some states where there are fewer doctors than we have, where we have nearly nothing in terms of health infrastructure, where the number of nurses to patients and number of doctors to patients is very low, we would have had it very rough and very bad in the country. You recall that many times when we had program here during COVID, I kept crying about some states not being ready. Despite the assistance given to some states by the federal government in terms of infrastructure, in terms of equipment and so on their own, they were just sitting and waiting. For me, coordination first at the national level that I talked about. How well is the Nigerian Medical Association carried along by the Federal Ministry of Health? How long are they carrying them along in what they are doing? We are partners in progress. How well at the state level are they carrying them along? Every state has a chapter and they're meeting. But when you go, you will not find how they are working with the State Ministry of Health. When you come here at the national level, I would expect, Dr. Jima just spoke. Since he came on board, I would expect him to be coordinating and working with the minister. That's the essence. There's no vertical delivery of any system, of any service that is helpful. It should be both vertical and horizontal. Now, coming to the quality of care in the country. Some years ago, when I personally came back to the country, one of the things I went to the minister and told him was, we have many nurses and midwives who have retired, but are still capable of delivering service. They retired because they had served for 35 years or they were 60 years of age. Why don't you organize something and bring them to service? And that's how the midwife scheme came about. And it helped. Like the Honorable Minister mentioned, and many people mentioned already, most of the maternal deaths that are occurring are not in the cities. They are occurring in the cities too, but most are in the rural areas. Why don't we mobilize these people, not only the midwives, the nurses too, those that have retired in particular, with a lots of experiences, and use them? Now, Dr. Nasidi just touched on something, and I want to add a little bit to it. It is not just the presence of a doctor or a nurse that matters, but the quality of the service that they render. If you are a patient and you go to a doctor who is relatively new and inexperienced, he is as good as a nurse. There has to be somebody who is training him, grooming him. How well are we doing in that? When you see the distribution of the health manpower in the country, it is very bad. Badly distributed. There are some states where you go there, you've got the number of specialists, you'll be sad. And some areas, there's nobody. I was appointed a member of hospital management board in a state some years back, and we were looking for specialists in different fields. We came to some fields where we could not find one in that state. We could not find. We had to look for them, people of that, indigenous of that state in some other areas, in some other states. We had to look for them, bring them back to that state, and then give them incentives to stay and train others. So I would like to see more coordination. I would like to see better quality of care. I would like to see how we can recycle those who have retired but are not tired and are still useful. I would like to see where, when you go to Europe, for example, UK and US, that are absorbing our manpower, they have a way of recycling too. We don't have. They have a way of replenishing what they are losing. We don't have. The issue of doctors going abroad, for example, why are they going abroad? Have we been able to address it? Look at the type of salary they are paid. Look at the risks that they were exposed to. In this studio, sometime 2020, we discussed how we lost 20 doctors in a week to COVID.
Okay,
Why?
Dr.
Because
Bosa,
they were relatively inexperienced.
Yes, I have to pause you for a while. It's amazing how time flies. When we're having a very serious and interesting conversation. I'm sorry, and I have to pause you for a while. We'll take a short commercial break. When we come back, we allow the Honourable Minister to respond. He has quite a number of issues to respond, coming from both Professor Desidi and Dr. Abuja and Dr. Jenaya. Let's take a short break now.
As the 2023 elections draw near, remember, evil prospers when good men and women only wish for peace, but never take a step to make peaceful elections happen. Are you a father? Are you a mother? What are you saying to your children as elections approach? Have you warned them not to let themselves be used to cause violence? Have you explained to them what the consequences of electoral violence might be? Do your part to make peaceful elections happen. Talk to your children. Protect them from unscrupulous politicians who want to put them in harm's way, while their own children are comfortable at home, within, and outside the country. Let's join hands to make 2023 elections peaceful. This message is from the National Orientation Agency, NOAA.
Every day in our country, senior citizens are discriminated against, disparaged, and treated with disdain by those who ought to respect them. We are all complicit in the way we have treated the elderly members of our society as institutions, families, or members of a shared society. Every time senior citizens get offered less than they deserve for the work they do because they are old, poor, and desperate, we are failing them. Senior citizen loses a child, and wow, they must be responsible for their death. Every time a senior citizen gets labeled a witch, is called mad, and shooed out of the way because they have no memory of where they were headed and look unkempt, we are failing them. We say, abeg, you don't old, make it do die, make everybody for rest, to ailing parents, uncles, and aunts. That's discrimination. That is neglect. When you see an old woman getting beat up and being accused of witchcraft, do not turn the other way. Stop and teach people that white hairs, wrinkles, and hunchbacks are no evidence of witchcraft. Aging comes with a memory decline. Sometimes it's not out of place to have elderly people lose their way, forget details of their lives, and how to properly take care of themselves. When they get to this stage, they deserve your empathy, not scorn. Our ailing fathers, mothers, aunties, and uncles are deserving of quality healthcare and peaceful transition. Make their last moments memorable. Senior citizens have paid their dues. They deserve your care. Stop all forms of discrimination against them today.
The Ministry of Police Affairs under my watch has been instrumental to strengthening the Nigerian police force to tackle challenges in the internal security architecture of the nation. To effectively achieve its mandate to protect lives and property within Nigeria, The Nigerian police have deployed operational intelligence and the ICT-based apparatus to tackle and stem the tide of crime and criminality. Some of these efforts include the maximization of the Force Intelligence Bureau, Intelligence Response Team, and Special Tactical Squads. 2. Digitalization of emergency contacts via the NPF Rescue Me application for emergency response at the tap of a button.
This message is brought to you from the Federal Ministry of Information and Culture.
Finally, the hero of Nigeria's democracy has arrived. He shall usher us into a new phase of development, peace, and prosperity. He is the father of the new Nigeria, His Excellency President Muhammadu Buhari, GCFR. Welcome to another season of giving Nigerians hope yet again. We are sure of a great future for both ourselves and generations yet unborn. We look forward to your leading us as a nation into our manifest destiny. Though the challenges against us as a people are many, we know that your leadership shall set us on the right path to our greatness. A new dawn beckons on us all, and having you as our president is a precursor to this. Thank you for believing in Nigeria. This message is from the Nigerian Television Authority, NTA.
All right, welcome back, and the program is still Good Morning Nigeria, and it's live on the network service of the NTA. Let me quickly, without wasting much time, we've already spent quite a lot of time already. So the Honorable Minister will take some of the issues that have been raised by the other guests, in addition to my question, which will be centered on, the facilities provided. Now we talk about, yes, out of COVID-19, lessons learned, we now have, more molecular centers, we now have more oxygen, we now have all this. But the viewer, and indeed the Nigerian, will say, these are healthcare infrastructure that address the ills or the ailments that afflict the rich men. I'm sorry to say, the wealthy citizens. Meanwhile, the alarming statistics that drive our health sector, that color our health indicators, are drawn from, the rural areas where you have primary health care centers. I understand that there's a division that the federal government is supposed to provide, the facilities, while the state government is supposed to, equip the facilities, and the local governments are to man the facilities. But again, Honorable Minister, the facilities have not been provided.
Well, that's correct. That is why I started out by saying that the Buhari administration has put a lot of emphasis on creating a balance in the health sector. There was an imbalance in the fact that most resources went to tertiary level care because those are more visible and more impressive, and they give more political capital. But in reality, most of the indices are in the rural areas and suburban areas and in the high density areas of our country. So what this administration is trying to do is to give more attention to that level of care, lower level of care, so that we have more inclusivity to bring in more citizens to be able to access health care. That's addressing the social determinants that Dr. Nasidi spoke about, having the health care near enough for you to get there. Secondly, the access, financial access. If you have to pay, that's a disincentive. People will not go there because they don't have money. So by providing the basic healthcare provision, you're also providing financial access. You can get there. And then finally, of course, the other service, the quality of service that you get there.
Are these services in operation?
And that's exactly the problem, in that the monetary inflow now requires not only the infrastructure, and by the way, this administration has redesigned the primary healthcare center to be a 24-hour service delivery organ. And then the provision of the human resources, those who operate it, it definitely has also been worked out that the local government and state government provide the human resources. So we have been encouraging the building of schools of health technology where this category of people will be trained. And we also know that a different problem there is health workforce attrition, in that you employ people in the city and push them to rural areas, they will not stay. The reality is that they stay for a few days or a few months and they leave. So we developed a strategy again of saying, select your candidates from the rural areas, the best ones, train them and then take them back to the area where they come from, and you have more retention in there. So all these problems that prop up are being studied and addressed, because every Monday we have a top management meeting where we look at problems and develop solutions to them.
But they're
Now,
not reflecting on the indices, on the statistics
well,
that
they
we're
are
getting.
reflecting, but the point is that these things you don't see immediate results. They are coming up. Secondly, the entire health service is a joint effort. It's not just the federal government, the state governments, and then the local government, and even the communities are being involved, because in the health sector we have the Ward Development Committee that's supposed to oversee the primary healthcare center and also report back on the service they are getting. So all these things have been set up. That's why the National Primary Healthcare Development Initiative is there to strengthen the primary healthcare level of care. But it is a joint responsibility, as I said, and you have to have state government interest. And because the interest of the state government will differ from state to state, you have more advancement in certain states than in others. So, but on the whole, you have to get that service located and being provided in all areas. So, to go back to the question of plan, there is no organ that works in government without a plan.
Exactly.
A plan works because we have to draw up a budget. So they say that to say that there is no plan is totally wrong. We have strong plans. We have a strategic development plan, and we have a plan for every item that we are working upon. Even for the COVID-19, the first thing we drew was to drop a plan and estimate how much we shall need for it.
Yes, we would like you to address the issues that the NMA, two critical issues. Kieran, sorry. We would like Dr. Ojima to please repeat those questions, those issues that he raised, so that the Honorable Minister will address them squarely. Please, could you go on with those issues?
You see, thank you very much for the opportunity to once again say this. Well, if the Honorable Minister has a plan, it would be nice to also bring other healthcare providers to see this plan. Now, the major issues I'm saying is this. One, the things we are seeing are targeted at responding to COVID. We need to know how we are going to improve the number of healthcare workers we have over the next 5 years, how we are going to improve the welfare of these people so that they don't continue to live, and also improve security in our healthcare service delivery points. Then the primary healthcare centers, for now, most of them don't exist. Those that exist are in a dilapidated state. These are the things I want to know.
Okay, I'm sure the Honorable Minister.
Yeah, good. I mean, there is a clear spin-off from the response to COVID-19 in that you see, money was voted to respond to COVID-19. So what has it brought us? It has brought us now oxygen plants in every senatorial zone. We didn't have that before. Now, oxygen is not only just for COVID. You need that for operations, carrying out surgical operations. You need it for treating asthma. You need it for treating pneumonia. You need it for a whole lot of things that normally they would not have been able to access if you didn't have plants. The same thing for ICUs, for treatment plants. You can use the same treatment plant, isolation stations for Lassa or for any other kind of disease that pops up at any time. So all these assets serve more than just COVID.
Exactly. I believe you totally, because there's no way oxygen will just be reserved for COVID cases. There are other cases that require that. But Dr. Jima, please, I want you to look at this perspective to this conversation. The performance of Nigerian doctors, the behaviorals of Nigerian doctors in practice. In this country, we know that doctors, perhaps in a surgery, for instance, in a surgery operation, for instance, if a mistake is made, the doctor does not tell the patient what happened. That does not happen. And in some cases, doctors make prescriptions of medications to patients without even letting the patient know the type of drug he or she is taking. And all that. And I want to paint this scenario for you. There are some doctors, Nigerian doctors in America and elsewhere, who have decided to come back home in form of brain gain to establish hospitals in Nigeria, to even bring back their knowledge to Nigeria. I have one experience in Enugu long time ago. I'm happy we're in Coast City. Long time ago, there was a young man from Mbo in Ogu Council area of Enugu State. He came back from America. Then in America, he was the best heart surgeon at that point in time. Right? He returned to Nigeria, came to UNTH, brought in equipment, assembled doctors, gave them lectures on new methods of heart operation and what have you. On his way back to his village, just a day after that lecture, he was killed. Now, there are doctors in Enugu who are performing. I know one in Ashwalia who people know as an enigma when it comes to appendectomy operation. He can do 60 in a day and nobody will die and all that. Doctors fought him to a point of no return. We also recall the Dr. Hugo of Test Tube Baby of the 80s and what happened to him and all of that. These are geniuses in the sector, but their fellow doctor didn't allow them to be. Everything cannot be government. So what are you going to tell us as the head of doctors in Nigeria on the performance of doctors in this country and how you can change the cut-off history of their behavioral pattern on duty?
Well, thank you very much, Mr. Mayo. Let me say this. A doctor was first somebody's child. He was raised in a home, or she was raised in a home, before acquiring medical knowledge to become a doctor. So medicine does not actually imbue the characteristics you see in people. There are certain modes medicine creates for those that are properly trained to fall into. But who you are, whether you're treacherous, whether you have a bad manner, actually comes from the home where you were raised. My summary of this point is the fact that remember that some pastors and some clergymen still sin. Therefore, you cannot expect all doctors to be perfect in behavior. There are good doctors, there are bad doctors, but you cannot use one brush for all Nigerian doctors. Now, the issue of the doctor you talked about who came home and within a short while was murdered tells you that those of us who are here face daily risk of dying. As of today, you try to hide your identity as a doctor in this country because people will feel that you have enough to be kidnapped or to be dealt with for financial benefit. People try to hoodwink you and they try to steal from you. There are doctors that are not okay, and that is why there is what they call Medical and Dental Council, Medical and Dental Practitioners Tribunal. Doctors have that ability to regulate themselves, and that is done by a tribunal. And if you watch closely the Medical and Dental Council handle for Facebook and Twitter, you will know when the tribunal is sitting. Doctors that err and are reported appropriately. Let me use the opportunity to tell Nigerians, going to the newspaper or social media to complain about malpractice is not a report of malpractice. You do a proper affidavit and send to Medical and Dental Council addressed to the registrar, and your issue will be taken up. But if you continue going to churches and complaining, it won't work. Now, I want you to understand also that patients are cheating doctors. Because we do not have this emergency healthcare fund implementation fully since 2014 that the National Health Act was passed. When emergencies come to hospital and the doctor decides to put away charging money and say, let us take care of the patient first, most of these patients get better and they run away or they refuse to pay their bills. And if you insist on getting your bill, they will start threatening you and they call hoodlums to attack you. So who protects the doctor? Finally, a hospital is an investment. Some people take loan to open that hospital you see, and therefore they should be well taken care of. Even the brain gain we are talking about, brain gain can only prosper in an environment of security and where there is availability of facility for investment. If you come back to Nigeria, where we have Bank of Industry, Bank of Agriculture, but no bank for healthcare infrastructure development, you can see our area of emphasis is wrong. Where can the agriculture and industry be if there is no health amongst the citizens? So
he snapped.
All right, Dr. Uche Ojima, thank you. Professor Nasidi, because he mentioned something about healthcare financing, which is, as is said in Yoruba parlance, in local parlance, is the kokoro, which is the core, to the issues we are talking about. Yes, we've said that over the years, the health sector, at least for the past 8 years, has received incremental increase in its allocation. And I know that budgetary allocation for this year was over 400 billion naira. Basic healthcare fund, we understand, was reduced from what it was last year to 47.64 billion naira. I don't know if I'm correct. And while routine immunization budget was increased, increased 64.2 in 2022 to 86 billion in 2023. How can we make sure that these provisions are utilized properly and judiciously?
Well, I thought this question would have gone to the Honorable Minister of Health.
No,
because
he will also respond.
Yes, actually, the best thing to take in mind is that how you deploy your resources is what determines the outcome. If you don't deploy it properly, you might end up actually misapplication or misusing it. And from that point of view, it is very important that okay, now the health budget is being increased and all this and so on and so forth. It's increased for particular purpose. The Ministry of Health must have sent some, activities and plans and all what should be funded. I believe it will be judiciously applied, but unfortunately, in the health sector, we have a lot of, unforeseen events occurring that takes us by surprise. As we are talking,
if you were to give a word of advice, on utilization, as a professor, yes.
So that's why I'm saying that we should always utilize. Is it put your money where your mouth is, or how did they say it? So that's the type of advice I would give. And don't forget, and we shouldn't forget that there are other things that have occurred that we must, reverse back. The COVID-19 has set us back. Some of the gains we made are reversed. COVID-19 is not gone. It's still rearing, rearing its head, coming. So if you spend your money, on wrong areas and it comes back again, before even the donors come, you will be, where you're going to be, and so on and so forth. Then also the, the key in terms of, deploying the this is, do you know that we already having information that some diseases that shocked us in the past are about to start rearing their heads again? Bird flu in Niger Republic, Ebola in the Congo, etc. So I think we should, plan to deploy the resources we have, including the finances, in such a manner that, we shall, keep Nigerians healthy. That is the main goal of all our health sector activities. How do I keep you healthy? How do I make sure that, you are not saddled with so many of these diseases, etc. So I believe we should go by the recommendation of Montgomery. You remember the Marshal who won the Germans in the North Africa, who said he had one tank, to about 10 German tanks, one plane to about 50 German planes, yet he won. So they asked him, how did you win? He said, look, it's not the number of troops you have, the armaments and all this thing that matters, but the way you deploy them.
Precisely.
Exactly, and the strategy, you can be militarily strategic, to win such wars. Yes. Okay, thank you. Dr. Eboja, no need to ask further questions. Just, come from any point of view, because of course everything has been on the table, so that we can now round off this program.
Yeah, I still want to talk about the budget for health. I'm still worried because the welfare of doctors and nurses and other classes of healthcare delivery depend on the money that is available in the ministries. Last year, we had nearly 4% of the national budget for health at the federal level. This year now is 1 trillion out of 21 trillion, which is 4.7%, which is still far below. I would want to see more money deployed to health. And when it is deployed to health, like we've just said, let there be a plan for the unknown. Because that's going to be unknown for sure. That there are emerging diseases that are coming. There are going to be emergencies, and we should have money ready.
How can government deploy PPP in the health sector?
Well, very well. You recall when we had COVID, a lot of Nigerians came and gave money. There are many government institutions right now that can be shared, that services can be shared with the private sector. If, for example, like we're talking about primary health care, where the federal government was supposed to provide the structures, the state was supposed to equip them, the local government was supposed to man them, why can't you partner with the local people? What is wrong with that? It's the service that we want. Let's look at all other options apart from what we are doing now and see where we can go and where we can have varieties. A place like Lagos doesn't have to follow the routine. They have the money. And they have the rich people that can partner with government.
Indeed. Since you mentioned Lagos, Dr. Bodia, thank you. Lagos is also one of the states implementing effective emergency medical ambulance services. And I know that there was a pilot. The pilot was done here in Abuja, Honorable Minister, if I'm correct, some time ago. So take along with you the issues you want to respond to on this. When are we likely to see full-scale rollout of the emergency ambulance service?
The emergency ambulance service pilot started in Abuja on the 14th of October, so it's already operational. I just sent a few clips to Mr. Wada Ibrahim of patient reaction to it. So by this month, 4 more states are going to join the pilot to study the results, and it's giving us a very positive kudos already. In that patients are now being attended to at point of injury or at point of need, and then taken over to a hospital, designated hospital that you know in advance. In those days where you have to go from one place to the other looking for bed and being told there's no bed, those days are gone. So, and then you also be attended to without being asked to pay at point of care. So that one will save a lot of lives and will bring a lot of comfort. And that's also a lot of modernization, because all developed countries already have that system. And we are due for that. So it's just a part of what we are coming up.
All right, Honorable Minister. Well, we are due for that. That would be some level of sophistication, to be injected in the health system. That would be very, very beautiful. But again, it's also important for us to do the needful at the local level, because the local governments in Nigeria are not functional, and therefore that area, there's a gap, a yawning gap in that area. And that is why, for health, what I said earlier on, that we are also providing health services the way we can through NGOs. And
Kiran, just before you sign off, sorry, Kiran, just before you sign off, the minister wanted to say something about brain drain.
Well, yeah, we are doing a lot to try and reverse brain drain, to first of all improve conditions of service, and also to make what is the discussion now going on with the Health Reform Committee that the president set up. How do we doctors get more job satisfaction and also better remuneration? If there's a performance-based remuneration, a doctor works very hard. Should be able to see the benefit of his hard work.
Okay, okay,
so that one is coming up.
Okay, Honorable Minister, we've had all that. Nigerians are looking forward to the actual implementation of all those policies in 2023 for better health for Nigerians. So at this point, we'd like to appreciate your presence here this morning.
Thank you.
Thank you indeed. Dr. Osage Henry, Honorable Minister of Health, Nigeria. Thank you once again. And I also had Professor Abdulsalam Nasidi, Pioneer DG, Nigerian Center for Disease Control and CDC. Thank you, sir.
Thank you very much
for coming. And Dr. Isaac Abuja, health specialist, public health specialist. We also thank you. We appreciate your coming.
You're welcome.
All right, now that's Good Morning Nigeria for today, as we may not be able to have time for sports. And of course, we're not forgetting my friend from Coast City there. Please pardon us for that. We would like to appreciate you for coming. And that's the national president of the Nigerian Medical Association, Dr. Uche Ujima. Thank you so much. We'll see you some other time. All right, and that's our package for this Friday. We thank you for being our guest, and please do that again on Monday when we return with a fresh package. My name is Kirian Umar. Have a great weekend.
And I'm Claire Adilabu Abdurrazak. Always remember to be with us in our campaign against rape and rapists. And do be good Nigerians.